Hello, my name is Penda Boma. I'm a student of Nightingale College, and today I'll be performing the PPE, Personal Protective Equipment video. I have on no jewelries. Unfortunately, I don't have my scrub yet. They haven't been delivered. So for this video, I have my PPE, my gown, mask, and gloves with my hand sanitizer. As a nurse, when getting into a patient's room, sometimes you might need to put on PPE to protect yourself against some situations depending on the type of patient that you're taking care of. For example, for airborne, you're going to need some N95 mask, gown, and gloves. For droplets, you're going to need a regular mask, gown, gloves, and goggles. For contact, you're going to need a gown and a glove. So I'm going to be performing doffing, which is putting on your PPE, and doffing, which is taking them off. I will go ahead and start by putting on my gown. Before that, I will perform hand hygiene. So here is my gown. I want to make sure it's on the right side. Put on my gown and make sure that it covers as much body part as possible. Go ahead and tie my gown on the neck level. I'm trying to make sure I cover as much body skin as possible to avoid contamination. Okay, my gown is on. Next, I'll go ahead and put on my mask. Make sure it's secure. And next, I'll go ahead and put on my gloves. I'll make sure the wrist of my gown is inside my gloves to prevent any skin contamination. Okay, my glove is above the wrist of my gown, is inside my glove at the wrist level. So I have done my PPE and I'm ready to go in and perform my procedure. I knock on the patient's door and I get in. After I check the two identifiers, make sure I got the right patient by the date of birth and their name, and check the wristband, I perform my procedure. Now I am done performing my procedure. I have to remove my PPE, doff my PPE. First, I have to remove my gloves. I'm going to pull my gloves out with my other hand. I'm going to create a ball with this one. And I'll use my 2 fingers into the other gloves. Make sure I don't touch no body part, no skin. Use my 2 fingers, remove that glove, put it in the trash. Next, I will go ahead and remove my gown. I will untie it from the back. Just like that. And right here, I will start taking off my gown from the neck. Make sure I don't touch the inside part. The outside part. Grab it from the inside. Roll it. In the trash. And I will take out my mask. In the trash. Then next I'll perform hand hygiene. I'll ask the patient if they have anything, any concern or any question. No, I would leave the patient's room, provide privacy, and go and document my procedure in the patient's chart. Thank you.